Wanda Gressett is a 75-year-old female with a history of chronic obstructive pulmonary disease, or COPD. She has been readmitted to our hospital and in the intensive care unit on multiple occasions. This is an all too common occurrence in patients with chronic disease.
I'd like to tell you that her story is unique. I'd like to tell you that it's one that we don't see very often, but in fact it is. It's one we see all the time. Patients like this with multiple comorbid conditions, with increasing complexities, are patients that we see readmitted to the hospital on a regular basis. Our board has stated that no hospital should receive a penalty from any of the 3 CMS penalty programs that put dollars at risk. And yet for Christus Hospital, we are below the national average for our readmission reduction program. And that equals $93,000 for FY16 and $252,000 projected for FY17. Yet we do an excellent job of caring for these patients while they're in the facility. We do absolutely everything we can while they're here to get them educated, to get them ready for discharge, to get a follow-up appointment scheduled within 7 days, and to re-educate them. And we help arrange any post-acute care that patient needs. We're doing everything we possibly can with these patients while they're in-house, and yet that's still not keeping them from coming back. We've seen our readmission rates for Medicare for heart failure be 15% for calendar year 2015, 12.4% for COPD, 13.7% for CABG, and 15.6% for CABG, which is nearly twice the national MIDAS database average. We have leveraged all our inpatient resources, and yet this isn't enough. In order to be successful, in order to extend our healing ministry, we need to do that within the community, extend out the reach into our community.
Our disease management clinic opened in November of 2012. Our staff that we currently employ are a nurse practitioner, a registered nurse, a social worker, a dietitian, a certified nurse assistant, an office coordinator, and a registered nurse navigator. Our first disease that we focused on was heart failure, and in May of 2015 we added COPD. Our focus is mainly on education and compliance on our patients. Our all-cause readmission for our disease management clinic from the inception of the clinic in November of 2012 through February of 2016 is 2%. This includes heart failure and COPD. Whereas the hospital's readmission rate, all-cause readmission rate on heart failure patients alone through February of 2016 is 18%. This next year we would like to increase referrals to our disease management clinic to include coronary artery bypass patients. We recently partnered with our CV surgeons and have gotten their buy-in to start seeing their underfunded or uninsured patients in the clinic. At this time, we are currently planning an education program and assessment program for those patients.
Now imagine if those readmission rates were something that we publicized. Imagine if this was the billboard on I-10. This isn't the image that we want to portray to our community. And yet when we ask providers why these patients are being readmitted, their frequent response is, well, it's patient non-compliance. So maybe in fact this billboard should say, where 1 in 6 patients are readmitted, and it's your fault. But we know that's not the whole story. We know that we have to transition these patients better into the outpatient arena. We have to transition the patients from the inpatient setting to home and provide a better way to care for these patients in a cost-effective manner. We have to, what are the real reasons that patients are actually readmitted to the hospital? Well, we know it's from fluid overload, we know it's from diet, we know it's from medications, whether taking them improperly, not enough, or not actually even filling their medications. And we know it's often from no home support there for these families. So what we're proposing is a care transition visit within 72 hours after discharge by a home health agency that coordinates with the patients and the family members prior to discharge, meet with them, gets to know them, reconciles their meds prior to discharge, and then when they do get into their homes, they are able to weigh them, take their blood pressure, make sure that they are stable clinically enough to get them to that follow-up appointment that we'll have scheduled within 7 days. We're going to make sure that they have everything that they need within the home to keep them stable enough to keep them out of our facilities. And we also want to make sure that it's important that education they learned within our facility transitions over to the education within their home. It's one thing to learn about diet and sodium when the patients are in our facility, and it's another thing to learn about it at home, pulling up their pantry, looking at their can of corn that they have that's 600 milligrams of sodium, and explaining to them, yes, this is a canned vegetable, but it's not actually a great heart-healthy item for them. because we know that diet plays a very important role in that transition to the outpatient setting.
Community needs-based expansion that the Disease Management Clinic has done. One of the things we're currently working on is a partnership with Meals on Wheels, where we would provide 3 heart-healthy, low-sodium meals and 2 snacks to our heart failure patients per day. We also recently partnered with our local university on a research project on what would be the best way to communicate with our low-income families. What we found was that most of our patients could not afford internet or computers, and the best way to contact them for follow-up appointments and to make sure that they are following their treatment plan was by the telephone. We currently provide scales and sphygmometers free of charge to our patients. We have a prescription drug plan assistance that we provide. This next year, we would also like to be able to provide transportation assistance to our patients, where we could get them to the clinic, to their primary care physician, their cardiologist, or any physician that they're seeing. We also provide an education program that we call Heart Failure University. We partner with our local physicians that give talks on different chronic diseases. But we also provide a heart healthy meal at the time of the talk, and it is open to the community. This is Wanda today. She joined our clinic in May of 2015. She has been to our clinic 8 times this past year, and since then she's had 0 readmissions to the hospital.
This is Wanda, this is Christus, this is us, this is how we are providing care. I think this is the model of transitional care that we can move towards. This is how we can extend our healing ministry into the community. Thank you.
Thank you. One more time.
Thank you.